Hi everybody, welcome to week 3. Just wanted to speak about a couple things and then lead a meditation for today. First of all, just some logistics. The peer group meetings should be happening this week, the first ones, and there's some instructions in the module regarding that. I invite you to please contact me, or if you're in Barbara's cohort, contact Barbara if you have questions about that. And just regarding the lecture for this week, it's by Trevor Buser. It's just below in the module here. And in that lecture, Trevor goes into some detail regarding especially 2 articles. One is by Pollack, and I've linked to it in the module. The article is called 7 Myths About Meditation, and it's a short article from the magazine called Psychotherapy Networker, and a short article but a very good one, in which Pollack goes into some of the pitfalls of being overly committed to certain forms of practice, and how that can really not work very well for certain clients. And so, yeah, I really invite you to check that out, spend some time with it. And then Trevor also goes into chapter 8 of the main text for our class. And this is the chapter on depression by Padula, and really focuses on some of the important aspects of presenting mindfulness, to just be attentive to and figure out the way you want to do it, and maybe and I think one of the overarching themes is really being open and non-directive in a way, and inviting clients to participate with you if they choose to, with all these activities. And then later in the chapter, Padula goes into mindfulness-based cognitive therapy, and Trevor discusses some aspects of that. I'm going to present just a couple points of theory, and then in the meditation that I'll lead in just a few minutes, we'll apply some of the ideas from mindfulness-based cognitive therapy to the practice. So mindfulness-based cognitive therapy really comes out of the group of practitioners that created mindfulness-based stress reduction, and touched on this in the intensive. MBSR, mindfulness-based stress reduction, was created by Jon Kabat-Zinn for treatment of pain, chronic pain. And mindfulness-based cognitive therapy really targets depression, but shares some similarities with that other approach, in that it's a group intervention. It's offered for a certain number of weeks, 8 weeks, I believe, for 2-hour meetings, and they do kind of a standard protocol of activities that form the intervention offered over these 8 weeks. So it's a pretty involved curriculum, and teachers are expected to have a lot of experience with the curriculum and go through a training program. But the principles certainly are ones that I think we are quite familiar with mindfulness activities that you certainly, I think, as you read the chapters, you'll notice practices you've probably done before as a participant, or maybe you've even practiced leading some of these exercises already. Very important for mindfulness-based cognitive therapy is that it is a cognitive therapy. So in that sense, we're working with cognitions or thoughts. Standard cognitive therapy, or CBT, cognitive behavioral therapy, identifies thoughts and can be very helpful to help patients or clients experience their thoughts as thoughts, not as facts, not as necessarily true. And in standard CBT, the approach is often to first help a client discern whether a thought is true or not, and meaning if it's 100% true or less than 100% true. If it's 99% true, that means it's not 100% true, so not one to believe in all situations. And if that's the case, then the therapist or the counselor helps the client identify new thoughts, or a new thought to replace that, what is called a negative thought. Importantly, in mindfulness-based cognitive therapy, that's not necessary. Rather, what's done instead is helping the client to change their perspective. So rather than working with thoughts and trying to replace a certain thought with a more accurate thought or a more helpful thought, you might just help a client notice that along with that thought, they have a certain feeling and perhaps a certain sensation somewhere in their body. And that's all you have to do. And that leads somewhere quite differently than standard cognitive therapy. And in this sense, it really is perhaps we could say a somatic therapy, perhaps in guise, because they don't sell themselves as this. But really, as we get into this practice today, you'll see, I think, that we are really working with a mindfulness practice that's attuned to bodily feelings and bodily sensations. So without further ado, let's go ahead and practice for a few minutes. And I'll be introducing this technique this is from session 5 of mindfulness-based cognitive therapy. So let's just begin by getting in touch with our posture. Find a still point, perhaps a center of gravity. I like to move a bit and find a place where my spine rests in a nice upright fashion. Bringing the attention inwards. Eyes can be gently open or closed. Letting the attention focus on the breathing, the sensations of breathing. Perhaps in the belly. Perhaps in the nostrils, or anywhere else that you feel the breathing happening. So focusing on concentration here, really trying to develop a practice in these moments that is concentrated on the breathing. And then at this point, inviting balancing that concentration with open awareness of what's happening in your body and in your mind. So seeing if we can maintain that focus on breathing, at the same time being attuned to whatever thoughts may be arising, whatever emotional feelings may be present. Whatever bodily sensations you're aware of. Noticing if the mind becomes distracted, right at that moment that you're aware of that, bring it back, invite it back to the body, the breathing. So the technique I wanted to introduce is, this is again is from MBCT, and it's a technique of deliberately bringing difficulties to mind while we're meditating. So I'd like to invite you right now to intentionally bring to mind a difficult or troubling situation in your life. Perhaps a good idea to not choose one that's overwhelmingly troubling, but perhaps a lower level, mid-level. So maybe take a few breath cycles to work with that, what comes to mind. And notice where in the body you feel sensations that are perhaps associated with this troubling situation. Perhaps unpleasant sensations or tense sensations in your belly or your heart area or somewhere else. At the same time, you may notice a tendency to resist those sensations, to push them away. And practice here is to deliberately try to counteract that tendency and invite, with a gentle, kind, friendly awareness, invite those sensations to be present. And get to know them. Start to understand them a little bit. It can be helpful here to continue working with the breathing. Breathe in a way, even if there's difficult sensations present, you can breathe in a way that makes you feel present and grounded, and maybe even a sense of peace. Breathing with these difficulties. And so continue to practice with awareness of the breathing, thoughts, emotional feelings, bodily sensations. Notice now what has happened with any difficult feelings or sensations that have been present. Maybe they're still present. Maybe it's shifted. And even if they're present, the important point here is learning to be open to face difficulty, And let's spend the next minute or so working in this way, working with the breathing, emotional feelings, bodily sensations. Paying attention. With an open heart. Okay. Thank you for your practice. And please be in touch if you have any questions. All right, bye.